Are you waking up with tingling feet, burning hands, or a strange numbness you can't explain? Millions of people silently suffer from nerve damage, and most don't even realize it until it's too late. But here's the truth: you can prevent it, and in many cases, even repair it. In this video, I'm going to show you 9 powerful, science-backed ways to protect your nerves, ease the pain, and support natural healing. Nerve pain? Don't ignore this. And trust me, number 1 is something you're probably doing wrong every single day. Let's dive in. 1. Control your blood sugar, especially if you're pre-diabetic or diabetic. Let's start with the most common and most overlooked cause of nerve damage: high blood sugar. Chronically elevated glucose levels damage your nerves directly, and also the tiny blood vessels that supply oxygen to those nerves. This is why so many diabetics struggle with peripheral neuropathy. What's more shocking? You don't have to be diabetic for this to happen. Studies show that even people with prediabetes can suffer early nerve dysfunction. Cut back refined carbs. Eat more fiber-rich, low-glycemic foods. Add cinnamon or apple cider vinegar to meals. The fix is simple but powerful. Eat for stable blood sugar. Replace white bread and soda with whole grains, leafy greens, and proteins. Every spike in blood sugar is like a slow burn on your nerves. 2. Get enough B vitamins. Especially B1, B6, and B12 nerves need fuel. And one of their main energy sources? B vitamins, especially B12. Without it, your nerves can't send signals properly. You may feel weak, foggy, or even get that scary sensation of pins and needles. What most people don't know is that as we age, our ability to absorb B12 from food declines. And if you're vegan, vegetarian, or taking antacids or metformin, you're at an even higher risk. Eat eggs, organ meats, leafy greens. Consider methylated B-complex supplements. Look for B12 as methylcobalamin, not cyanocobalamin. It's better absorbed and used by your body. 3. Limit alcohol consumption. It might sound harmless, but alcohol is a major nerve killer. It depletes your body of B vitamins, damages your liver, which helps detox your blood, and directly irritates nerve endings. Heavy drinkers are especially at risk for a condition called alcoholic neuropathy, which affects about 50% of chronic drinkers. Limit to 1 to 2 drinks per week. Replenish nutrients afterward. If you enjoy a glass of wine occasionally, that's okay, but pair it with nerve-supporting foods and consider extra B vitamin support. 4. Follow an anti-inflammatory diet. Inflammation is the enemy of healing, and chronic inflammation caused by sugar, seed oils, fried food, or even stress can worsen nerve damage or slow down regeneration. Anti-inflammatory foods can protect and rebuild nerve tissue. Top picks: wild-caught salmon, omega-3s, turmeric with black pepper, curcumin, berries, antioxidants, olive oil, polyphenols. The University of Maryland Medical Center found that omega-3 fatty acids significantly increased nerve regeneration in rats by more than 50%. Avoid vegetable oils, fried foods, sugar. Embrace color-rich fruits, fatty fish, greens. 5. Move every day, even if it's gentle. Movement isn't just for muscles, it helps your nerves too. Regular movement increases blood flow, oxygen, and nutrient delivery to nerve cells. Exercise also stimulates BDNF, a brain-derived compound that promotes nerve growth and repair. Walk, stretch, or do yoga for 20-30 minutes daily. Try resistance bands. Even gentle movement matters. Sitting all day compresses nerves and slows circulation. Try standing every hour or doing leg stretches by your desk. 6. Try Alpha-Lipoic Acid, ALA. This powerful antioxidant has been used for decades in Europe to treat diabetic neuropathy. Alpha-Lipoic acid reduces inflammation, improves nerve conduction, and even eases nerve pain. Science says 600 mg. Day of ALA has been shown in studies to reduce tingling, burning, and numbness in diabetic patients. It works best when taken consistently for 2 to 3 months, and with food. Talk to your healthcare provider before starting supplements. 7. Review medications and toxins. Sometimes the source of nerve damage isn't disease, but drugs. Certain medications, like statins, chemotherapy agents, or even antibiotics, can damage peripheral nerves. Heavy metals like mercury or lead can also wreak havoc on your nervous system. Get tested for heavy metals. Talk to your doctor about medication side effects. Statin-induced neuropathy is real, even if rare. Always review long-term medications with a healthcare provider especially if you've noticed new tingling or numbness. 8. Prioritize sleep. Lower chronic stress. You heal in your sleep. That's when your nervous system repairs, detoxifies, and regenerates. Poor sleep disrupts all of this. Stress adds to the problem. It tightens muscles around, elevates cortisol, and depletes key nutrients like magnesium and B vitamins. Tips to improve sleep. No caffeine after 2 p.m., magnesium glycinate before bed. Turn off screens 1 hour before sleep. Keep a consistent bedtime. Just 1 week of poor sleep can lower pain tolerance and worsen inflammation. Protect your rest like your life depends on it, because it does. 9. Try natural remedies that support nerve repair. Certain supplements and remedies can help calm, regenerate, and stimulate nerve function. Some of the best include capsaicin cream from chili peppers, reduces pain by numbing pain signals. Acetyl L-carnitine supports energy in nerve cells. Magnesium calms nerve activity and muscle cramping. Lion's mane mushroom promotes nerve growth factor, NGF. Always consult with a professional before combining supplements, but know this: nature is full of solutions your nerves will thank you for. Reduce or eliminate caffeine. This might surprise you, but caffeine can contribute to nerve damage, especially when consumed in excess. Caffeine is a central nervous system stimulant. In small amounts, it can make you alert. But in large, chronic doses, it overstimulates the nerves, increases cortisol and adrenaline, and leads to nerve fatigue. For people already experiencing neuropathy or nerve sensitivity, caffeine can worsen symptoms like burning, tingling, or anxiety. It also acts as a diuretic, flushing out essential nerve protective nutrients like magnesium, potassium, and B vitamins. This nutrient depletion makes it harder for your nerves to function and repair. Limit to 1 cup day or switch to herbal teas. Stay hydrated. Replenish magnesium and B vitamins. If you suffer from nerve pain, try cutting caffeine for 2 weeks. You might be shocked how much better you feel. Now, here's what most people miss: the biggest hidden nerve destroyer. It's the food you probably eat every single day. Refined seed oils like soybean, corn, and canola. They're in nearly every processed food, and they're highly inflammatory. Cut them out, and you could dramatically reduce nerve pain over time. So, what's the first thing you're going to change? Are you cutting sugar, adding B12, trying turmeric or ALA? Let me know in the comments. I read everyone. If this video helped you, hit that like button and subscribe for more health science every single day.